Thank you very much for the honor to speak today. So my talk's going to be a little bit different. I know there's a lot of you that have stayed in from the last session. So these topics kind of overlap, but I'm going to really try to explain to you how filtration works and why it's so important. Here are my disclosures. Okay, so we know that surgical smoke has a lot of bad properties to it. We really need to filter it out. We need to try to mitigate the negative effects of surgical smoke. And our AORN partners have been telling this to us for 40 years. And as surgeons, we don't listen. We don't think surgical smoke is such a big deal. But when COVID-19 happened, that all changed. AORN became our best friends. They had all the information about surgical smoke and the mitigation factors that we've been ignoring for 40 years. And the next thing you know, we're partners and we're trying to educate the world on how to stay safe. Maybe not from surgical smoke, but from COVID-19. So I showed this on my last talk. So basically the particles are very small. And there are many particles that can infect us in the OR. So the key thing about filtration is knowing the difference between HEPA and OPA. So basically, once again, this is a slide from our last session, but we really want to be using OPA filters where it can filter 99.999% of particles 0.12 microns or larger. So that is kind of in the range of what COVID-19 and some other viral particle sizes are. So once again, we need to use a multifaceted approach, proper room ventilation, appropriate PPE, and smoke evacuation devices in our ORs for laparoscopic, open, and endoscopic surgery. So this is a really good diagram. So if you've ever operated on a COVID-19 patient, and now at our hospital, we do a rapid test before they go in the OR. And by the time they get intubated, we don't know the results. And usually it's like 10, 20 minutes into the case, they'll call in, hey, Dean, your patient's COVID positive. And everybody stops and they're like, oh. So at that point, nobody's allowed to leave the room for 20 minutes. And I always wonder, why 20 minutes, right? So we know that there's 15 air exchanges in most positive pressure ORs. So 20 minutes, so every 4 minutes, we recycle all the air into the room. So that's 5 cycle changes. So they think in 5 cycles, it can clear all the virus out of the room. So the highest peak of viral particles is during intubation. So during intubation, your anesthesiologist is using they're intubating, and all those viral particles get released into the air. So let me give you a huge tip. If you are in an OR and they tell your patient's COVID positive, you need to find the vents, the vents that suction the air out, and you need to get as far away from those vents as possible. That is where all the virus is going to go. So ask your nurse, where's the vents? Or look for the wall and look for those vent, guides, and to get away from them, because all the air is going to be suctioned through those vents. So especially, so if your anesthesiologist is on the right side of that picture, go to the other side of the room, because that's where all the viral particles are going to be in the room. So once again, 5 minutes after using an electrosurgical unit, the concentration of particles can be 60,000 to 1 million particles in a room. So 20 minutes, that's the key. 20 minutes after that, that's when all those particles are gone. Remember, find the vents, run away, try to breathe shallow, and hopefully you don't get infected. Okay, so these are the engineering controls we see in the OR. So we have OPA filters that are hooked up to your canisters that you're using your Yankauer suctions for, right? We have inline OPA filters on your pencil. So that's probably the most effective way if you're doing open surgery, using those inline suction devices right on your pencils. Our smoke evacuators, a lot of them, if not most of them, have OPA filters in it. Remember, the key is go back to your OR staff. I want OPA filters in my room. I don't want HEPA filters. I want OPA filters. And of course, you want the proper capture devices for your OR. I showed this at the last talk too. This is probably the most important thing you can take back with you, is this hierarchy of control. Positive pressure ventilation in your OR, Second, substitution, right? You want all that air out through the vents. Third, only necessary people in the OR on a high-risk patient. Fourth, administrative controls. Educate your OR staff on mitigation techniques to keep everybody safe. And the least effective thing we do, which we think is the most effective, is we should wear proper protective gear. But that's the least effective way to mitigate smoke and particles. So this is the big thing I want to talk to you about, is this mechanism of filtration. So when I was on the task force for SAGES on COVID-19, I was like, how come people are not getting sick? Because N95 masks are like HEPA filters we wear. Filters 99.9% of particles, 0.3 microns or greater. Coronavirus is 0.06 to 0.12, so it's much smaller and should go through your mask. But we know, I've taken care of so many COVID patients. When you wear an N95 mask and you have eye protection, you don't get infected. The reason why is electrostatic attraction and diffusion random Brownian motion. So we have straining. So straining is pretty simple, right? The particle mass or the weave can catch a viral particle. Inertial impaction, the particle runs right into a fiber in your mask and stops it. But electrostatic attraction is what N95 masks are made of. So basically the particle is floating in the air and the mask, like a magnet, pulls the particle right into one of those fibers and stops that virus from actually getting infected. So another thing I really learned is all N95 masks are not made the same. You need to know what your PF or protection factor is on your mask, right? So PF equals the count of virus outside your mask versus the count of virus inside your mask. So you want a PF that's really high. Unfortunately, N95 masks are rated at 10. That means for every 10 virus particles outside your mask, you have 1 inside your mask. So if you are on a crowded elevator in Las Vegas and somebody coughs and has COVID, there's gonna be like 100,000 viral particles within 6 feet. So first thing you do is step back, don't breathe as deep as you usually do, and hopefully your N95 mask, if you're wearing it, will protect you. But remember, 100,000 outside, that means you have 1,000 particles inside your mask, or 10,000 particles inside your mask, and you're probably being infected. So, but still, we're hoping that the static, electrostatic factors can actually protect you. So SARS is once again 0.06 to 0.14. We know that N95s work best between 0.04 and, or work, the worst between 0.04 and 0.2. But we know N95 respirators are about 8 to 12 times better than regular surgical masks, so that's what you should wear in the OR. And this is a typical box for an N95 mask. You need to look at the assigned protective factors. When you're on Amazon trying to figure out your next purchase for N95 masks, look for the protection factor and make sure it has advanced electrostatic media built into the mask. That is the safest mask you can wear. Okay, so we talked about this the last time. Before COVID, we really didn't think surgical smoke was that bad, and we had webinars on it. We had maybe like 50 people on the webinars. During the height of the pandemic in 2020, we had a SAGES COVID session. We had 3,000 people on that webinar, all wanting to know what to do if you had to operate on a COVID positive patient. Once again, this is available on our SAGES website. It kind of tells you the basics of what to do if you're operating these patients. And this is not a complete list. This isn't the SAGES. We have a SAGES repository of a lot of the devices. There are many more that have been added on since I made this slide. But basically, when you're in the OR, try to find what insufflator you have, and then look at what kind of filtration, right? You're looking for the letters U, L, P, A, ULPA filter. You want an ULPA filter built into your system. You want that micro filtration kind of built in. So in conclusion, in order to protect your OR team from surgical smoke and infectious elements, you need to use all these factors. You need to adapt surgical technique to reduce the risk of getting infected. Once again, multifaceted approach with proper room filtration, ventilation, appropriate equipment and smoke evacuation devices. Thank you very much for your time.